Good afternoon, I'm Rob Cocklarts, and we're here today at the 5th International Conference on Alzheimer's disease near Heathrow Airport in London. I have a personal interest. My mother has been badly damaged by dementia recently, which has accelerated. And I wanted to talk to two of the leading lights, if I can use that phrase, in looking at how to slow down the process of Alzheimer and dementias. I have with me, I'd like to introduce Anita Saltmarche, who will talk a little bit about her work in researching using advanced light therapies for reducing the speed and the onset of dementia. And I think her partner, although not in crime, as it transpires, Lew Lim, who has manufactured a very interesting light device, which is showing some great efficacy in the treatment of Alzheimer's and dementias. So perhaps if I come to you, Anita, initially. Okay. You've been doing some research, I believe in Ontario, in Canada, on the basis of a long background you've had as, I believe, a nurse working with dementia. Could you tell us a little bit about that background, how you started to get into light-based therapies, and the frame of the research that you've been doing recently?
Thank you, Robert. I've essentially been involved in light and laser research and clinical practice for about 15, 16 years now. Mostly in the musculoskeletal realm, starting there. But really, in the past 9 years or so, been involved with the treatment of traumatic brain injury, and which was that first, progress into this field of dementia and neurologic degeneration. So the study we've just completed, and although it started out as a feasibility study, a pilot study, really to understand outcome measures that we were going to use, a research methodology for a larger study, and understand the needs of patients and the family caregivers who would be involved. We were surprised at the significance of outcomes that we saw in a very small population, which really made us sort of sit back and go, we knew this was we had an inkling that it would be successful, but not only by numbers and outcomes on mini mental state exam and the ADAS COGS, which are tools, standardized tools that are accepted in clinical practice for looking at cognitive impairment, but qualitatively hearing from family caregivers the difference in communication, functional abilities, behavior, and then actually visually seeing differences in patients from the beginning of the study to the end of the study, and were amazing, actually. So
you've got a long track record in using innovative therapies around dementia as a nurse and working with really quite chronically suffering patients in reasonably advanced stages of dementia. People are going to be saying, light therapy? Well, what's that? How does that work? What's that all about? Is that something to do with vitamin D and sitting in the sunlight? And we know it isn't. So let me turn perhaps to Lew Lim, who has a light device that you own a patent for, and you have invented, and a company called Vielight, which is responsible for marketing that device. And your particular device and technology was used in the study that Anita and her team did in Ontario. Tell us a little bit about your background, Lew Lim. How did you get involved in light, and what is light therapy? Because a number of people out there are perhaps a little bit confused right now.
Well, a little bit on my background. My experience as an engineer was relevant to this. So we looked at what was done by the Russians when they introduced light by, believe it or not, injecting into the vein to get
this
into
is
the
intravenous light,
right.
Yeah, which was used as a treatment, as an antibacterial, or what was the reason for this
Well,
use by the Russians?
It was actually exploratory to begin with, because by that time in the mid-80s, they found that low-level laser was having an effect on when you apply it, on the skin, it was helping the skin to heal, helping hair growth, and accelerating wound healing.
Low-level light,
Low level.
not high-energy lasers, not the sort of industrial lasers we see in Goldfinger and in that
That's
great
right,
James
that's right.
Bond
That is
classic
really
that everybody
interesting.
remembers. This is much lower energy amounts of light,
Right.
and
right.
they were noticing a regenerative effect.
Yeah. So, without going back into the details of history and so on, by that time, the scientists had discovered that laser actually at low level was healing rather than causing damage.
It had a healing effect.
Exactly. Now the question was, what if you find a way to introduce it into your body? Does it create some kind of a healing as well? So they injected a light in, actually it was laser, into the brain, into the circulatory system, and found good effect, especially related to circulatory system and the heart. They were starting to discover that it helped with the diabetes, for example.
Right.
So this is invasive, so why not look at a non-invasive method? The whole idea is to deliver photons of that particular wavelength into the body. Now the nose,
Photons being the particles of light, if we can use that phrase, as Albert Einstein first identified. The energy of light, defined from a physical point of view.
So photons have penetrative qualities. So if you introduce where there's very thin barriers like the membrane of your nose, and there is also rich vasculature, it is a way to introduce into the body, and we found that the outcomes are very similar. So we started with intranasal.
So you're applying low energy laser light intranasally, up the nose basically, to treat neurodegenerative dysfunctions.
Right, that would be the next step, right? And
a little bit of disbelief, which we see in the community all the time. So it's a good question.
Okay.
Well, there's disbelief in general about the value of light-based therapies, isn't there? Because they're not like pills. Aren't we used to taking pills? Pills are supposed to get us better. Isn't that what we used to? Or maybe we go and see the physiotherapist. But what happens when we start to have a chronic neurological dysfunction, as in a dementia and Alzheimer's?
Right, let's start with a couple of fundamentals here. One of which is, it is now fairly well, obviously even very well established, that if you can introduce light energy within the red and near infrared range in the spectrum, you can actually draw a positive response from cells.
Now, this is this related to the fact, I believe you're both in the famous book, The Brain's Way of Healing. They talk about rewiring the brain with light. So are we saying that we're using energetics, we're using light to influence the chemistry of the brain and to influence the neuroplasticity, the way the brain expresses and evolves its chemistry? This famous book, The Brain's Way of Healing, Anita, I think you're quoted in the book. And that has a whole chapter which I think has really stimulated people's imaginations about how does the brain respond to particularly energy in the form of photons of light.
There are probably a number of different things that are occurring. We've got an increase in blood flow to the area.
Yeah.
We've got an absorption because of elements in the cells that are actually able to absorb that energy, which results in an increase in ATP, the gasoline of the cell, essentially.
Yeah,
and
adenosine triphosphate, yes, if I'm
exactly.
right, which is the basic mechanism by which our cells power all of the activities of our body function, including obviously our neurons in our brain.
Right, and so we're actually delivering that energy. We also know there's an anti-inflammatory effect going on, but you would probably want to elaborate on that as far as...
It's interesting you should say that, because I know you've done some of this work with Professor Mike Hamblin in Boston at the Wellman School of Photomedicine, and Mike Hamblin is known worldwide, as I think, as one of the leading scientists looking at how these mechanisms operate. And I believe you guys have given this a term, photobiomodulation, if that's right. So how the body responds to particular types of light, and using predominantly infrared light, is that correct?
And visible ray for photobiomodulation, usually within those.
So this has nothing to do with ultraviolet light, the high energy end of the spectrum. And I believe I'm right, most of the light that actually hits our planet that comes to us is predominantly infrared, although we talk about ultraviolet all the time. So you're leveraging infrared and red light. What sort of wavelengths with them are we using here?
So when you talk about red, you're talking about basically from 600, just over 600, to about 780 nanometers before it becomes invisible.
Right, into the infrared.
Right, so when you talk about near infrared, it goes a little bit beyond visible, and you're going up to maybe like even 1,000 nanometers or even more. Right. But we are applying actually 810 nanometers, which is a little bit out of the visible range.
Right.
The reason we use 810 is actually it has shown the greatest penetration in live tissues, and also a really good response from central nervous system, actually nerve tissues. And you might think intuitively that maybe it should go longer, but when the wavelength goes longer, a lot of it gets absorbed by blood and water.
Right.
So you lose quite a bit of that.
Yeah.
And research shows that 810 more or less should give you peak.
And you mentioned this is low power.
Low power too.
It's not going to damage the cells.
Correct,
So,
yeah.
so what sort of power are you using? I mean, we're talking about a few milliwatts here. Can you help us understand? It's nothing like the power of a light bulb, is it?
That you're talking about, hundreds of thousands of. You're talking about watts.
Yeah.
Okay. Here we're talking about milliwatts.
Milliwatts.
So milliwatts,
1,000 of a watt.
Right. And we're applying anything from from a portable device of like 14 milliwatts up to 100 milliwatts. So in this particular device, in the study, the maximum power was just 41 milliwatts. Really, really
41.
low. 41.
Okay.
And
so that's not going to cook you in any way. It's not
in
going to
any
heat
way,
you up.
and it's not even laser.
Right.
So you might.
When you say it's not a laser, I mean it's a form of pure light. So you're generating this light through a diode, a light-emitting diode. Right.
So it is out of a light-emitting diode. It's non-laser, so it's non-coherent, not like laser.
Right.
And that's really. There's no question about safety now. It's really low. It's non-laser. Even if you look at it,
right.
There's no harm to your eyes. So now the question is, so low power. How is it possible to go to the skin and go into your, to the dura matter, into your brain? But we can measure it. It's measured before through fMRI, and we've done it recently through a brain match with quantitative EEG.
So my understanding is that you've also worked with Margaret Naser in Boston, and she's got image scans showing the before and after benefits of using this type of light-based technology. So she's showing in MRI scans damaged areas of the brain from vascular dementias, for example, and post-treatment successful results in actually those image scans. So I think for context, we'd like to come back to Anita in a minute and talk a little bit about the group that you did the work with and the core results. But Lew Lim, you've got to show us your device now. People are saying, what does this look like? Intranasal?
I'm glad you asked.
Well, I'm not looking to give you too much of a commercial plug here, Lew Lim, but I do think people want to know.
People want to know what it looks like, definitely.
They want to know what it looks like. So what is this rather beautiful device?
So this is the Neuro. I wanted to say that, in treating dementia, I think it's really important that it is portable, wearable.
Because you use it at home, aren't they? People take them home and use them. I think, Anita, you're going to talk a little bit about how often they use. Can you put it on and show us?
So we are directing near infrared light to the brain
Yep.
to the default mode network. The default mode network consists of, the hubs consist of the medial prefrontal,
Yep, prefrontal cortex,
the precuneus,
precuneus.
the parietal area, as well as deeper in the posterior cingulate cortex, which is really key for Alzheimer's, and then intranasally to point to the hippocampus.
Now the hippocampus is important, isn't it? Because it does some very important things in the way our bodies function. Can you share that with us? Maybe Anita, would you say a little bit about the hippocampus? I mean, Lew Lim, please don't take that off for the moment, because that looks just great on you, and I think people are going to be quite keen to see it.
I'm going to be known for this.
Well, I wonder whether
That's
you'd even turn it on for us. Whether you make
Oh,
it ready to
yeah.
do that.
Yeah.
Why is the use of the intranasal light, from your perspective? Because other people doing light therapy, you've got a number of innovators like Dr. Khan and his team at Meditech in Toronto. They're also using red light, and they're widely reported in the brain's way of healing as having efficacy. Why do you go down the intranasal route rather than, say, the route that Dr. Khan is using, which I think is predominantly around the back of the neck and again around the cranium?
Well, I think there are two things. The intranasal gives access, if you think of the location, what the mucous membranes in the area and blood flow, but also the direction of where that light is being pointed. And the hippocampus, which is involved with Alzheimer's disease and malfunctioning in that area. And so what we're doing is providing that energy so that we can help to heal and have an impact on that area of the brain.
Right.
And because it's so deep inside the brain, we need a way, not just transcranially, but of directing that energy so we get a sufficient amount of energy at the target tissue we need to be directing it at to get effectiveness. So this is really, there are other technologies, but the introduction of the intranasal component, I think, adds a whole other level of delivery of that energy to the areas of the brain that we need that.
So the way I might interpret that is it must be a lot easier to get this light energy, these photons that we've been talking about, which I think everybody intuitively knows light has energy, but these photons perhaps are getting into the brain cells more readily and into some of the regulatory functions within the brain that we know are impacted as we see neurodegenerative dysfunctions such as Alzheimer's and dementia. So Lew Lim, maybe you would talk about why are these different components, as we see you putting the technology on, why did you put them where you've put them? You mentioned that there are different functions in the brain. Are you using the light and in the different regions of the brain, and how do we know the light actually gets through the skull? Because a lot of doctors would have a problem with that.
So I think we briefly mentioned that you can use fMRI imaging and quantitative EEG. You can actually see, if you use the latest technology in QEEG equipment, you can actually see the brain responding in real time. We did that just a few days ago in Florida for the first time. Actually, it's quite exciting. Now, I think ultimately the test of the pudding is in the outcome.
Right.
And just judging, for example, in dementia, the outcomes have been measured, in cognitive scales.
Well, let's talk a little bit about your study in a bit more detail, Anita. And I know we've got a limited time here, so maybe give us a sense of the scope of the study and what did people actually do with Lew Lim's device, for how long, and what results did you have over what period? Maybe you could share that with us, and maybe take a couple of case studies, pull a couple of case studies out, because I know you've had some quite remarkable results.
The study was a pilot study. It was a feasibility study, really looking at sort of testing that methodology, and in a total of 19 patients that we recruited, and in the Toronto area, and essentially did see some pretty remarkable results. We started with baseline assessments. We were using the mini mental state exam, maybe not the most sensitive, but widely used in clinical practice, the ADAS COGS, so that we could get further detail in cognitive abilities, and then also looked at some qualitative data collection along the way. The study in itself was 16 weeks,
16 months.
12 weeks of treatment,
Right.
and 4 weeks where we removed treatment to see whether or not there was any erosion or change,
Right.
and then a follow-up visit.
And the treatment was every day in the home
No,
environment?
so essentially what we did, and again, we were trying to test out how difficult was it for family members to bring in someone with dementia into a clinic. So
Yeah.
they came to a clinic twice a week the first 2 weeks, and then weekly for 10 weeks after that, for a total of 14 treatments. Interestingly enough, and we didn't know how quickly we'd start to see results, but we were seeing results as early as 2 or 3 weeks into treatment.
2 or 3 weeks of regular treatment, and you'll
So they
see.
saw clinic, we saw them in a clinic,
Yep.
but we also sent them home with just the intranasal device, not the whole neuro.
So not the whole piece,
No,
just the intranasal component.
because there's a
Okay.
separate device for that,
Okay.
and they treated daily at home. And I think they treated quite consistently. They were sent home with a daily
20
journal.
minutes a day, half an hour a day?
20 minutes when we do the neuro in the clinic, and 25 minutes. Really easily used. You push a button, it turns on, automatically turns itself off.
And most of these people were late onset dementia, or where were they along
We had a
the...
variety in the 19 patients that were included in the study, and we had some with early cognitive impairment, but we also had some people, if we were looking at a mean mental state exam, in that 5 to 6 range, many more in that sort of mid-range, so it was sort of that mild to moderately severe group.
So, you know, we're limited for time here, folks, so I think that you said some quite great improvements. Tell us about the most remarkable results you had, and tell us also about the most disappointing results, because there are a lot of doctors out there who'll just be saying, light, sort of, I
Right.
get it, it's energy, I remember back to my chemistry, you know, there's something going on here, and we certainly respond to light in the skin, but in the brain, what were the best results you had, and where was the disappointment? Can you give us some?
I think some of the most significant results were in the ability for those with dementia to be able to communicate. And then if we're looking at caregivers, less disruptive behavior, less wandering, all really important. These were all individuals living at home
Right.
with caregivers. So we're not talking about institutionalized individuals. So abusive behavior, wandering, uncooperativeness, those behaviors changed. And probably one of the most significant was sleep.
Right.
They slept longer, so did the caregivers. But interestingly enough, we didn't know this was going to happen. But when caregivers were seeing such significant difference in their loved ones, they're going, maybe I should be using this. So in fact, they started using the intranasal at home.
So the
were
caregivers started using the technology?
They started using the
Because of the
technology
benefits they'd
after-
seen
that's
with
right.
the dementia.
And this
So-
was after the study. We followed them after.
So,
and,
guys, this is remarkable, I think, and I'm sure people would like to know a little bit more, and I know they can reach you, and maybe they can research the conference result as well. We've got to end here, but I understand some of the work that you've done with the technology. You're now going to be going into a longer trial. Can you say a little bit about that and what you hope to get out of that in the last 30 seconds or so that we've got?
Well, first of all, the results have been submitted for publication, so we're hoping that will be out relatively soon.
Okay.
And I think all the way around, the study seems to justify a larger randomized controlled trial, which is in
A
the process,
double-blind.
actually, double-blind trial, which will be in the process of being developed right now, methodology, and the group that will be involved in the study has been selected, or some of them. And any more you want to say about that?
Well, at this point in time, the methodology is being put together. I think it's going to be a pretty high-powered and independent group that is going to do the research.
Yep.
So stay tuned.
So a number of people might be asking, how does this light therapy work? Well, the science has been given the name photobiomodulation. You can, I think, find it on Wikipedia. I hope so. And certainly you can research it through the work of Mike Hamlin, Anita Saltmarche, Lew Lim, and many of the other leading lights, if I can use that phrase, in this emerging area of non-invasive, but what seems to be remarkably effective therapy. Thank you for your time. Thanks, guys.
Thank you.
Thank you.